One of the greatest difficulties patients face when they try to do active range of motion exercises at home is stretching their hip flexors and quads independently. The BakTrac helps you with this stretch with ease. As you can see with Jenny, who is a runner, by the way, so her hip flexors are quite tight. You can see that first of all, she can apply plenty of knee flexion, which stretches most of her quads, but also with further stretch, she can apply hip extension, additional hip extension, which will get into her hip flexors and provide great benefits to prevent some of the reoccurring chronic back problems. Once again, the stretch is easy to apply. She controls the force of the tension, and also with the locking device, she can just lock it in, and from then on, she doesn't have to do anything. With the hip flexion, with the hip extension increased, she can independently stretch out her hip flexors. One of the bigger problems we have as we get older, that the hip flexors are getting excessively tighter with age, and in Jenny's case also because she's a runner, so her hip flexors are chronically tight. So besides stretching the main part of the quadriceps by adding bending the knee, she can also add hip extension using the BakTrac, and when she pulls on the rope a little bit further, it pulls the knee backwards, adding additional hip extension and greatly stretching the hip flexors in the front of the hip, which are chronically tight in runners, but also as we get older, we are all can look forward to having tighter and tighter hip flexors and having problem to get them stretched out. So the BakTrac really helps with this problem.